Today's patient is a 2-year-old female who presents with her mother with complaints of left ear pain for the last 2 days. She has had poor sleep for the last 2 nights. She has also had some cough and congestion. She was previously treated with ofloxacin ear drops with no improvement. Her mother denies any fever, vomiting, diarrhea, or otorrhea. Her fluid intake and urine output have been normal. She did have a bilateral laryngotomy with tympanic ventilation tube placement in October of 2024. There's no other significant medical history. Her general appearance is alert, well-nourished, no acute distress. She does have obscured tympanic membrane in her left ear by purulent material in her external auditory ear canal. She has a clear and intact right tympanic membrane. She does have some mild congestion, but no nasal discharge, no erythema in her throat or exudate. Otherwise, her exam is unremarkable. My assessment is acute left otitis media. The diagnosis is supported by the patient's ear pain, the purulent material seen in the obstructing the left tympanic membrane, and her lack of improvement with ofloxacin ear drops. And given the placement of tympanic ventilation tube placement, she is going to be prone to recurrent otitis media. Her symptoms of poor sleep, cough, and congestion also suggest upper respiratory infection. However, due to her presence of purulent material obstructing the left tympanic membrane, this is why I am choosing to treat her for acute left otitis media. Another differential diagnosis would be sinusitis. However, there is no facial tenderness or fever, and the patient's hydration and urine output status is normal for her, and she does have the complaint of ear pain specifically. I did probe my preceptor on which antibiotics he would typically prescribe for otitis media when drops have failed, and I suggested Augmentin. I also probed him on follow-up necessity for the patient, since this is a recurrent or continuing infection with previously failed treatment. We started amoxicillin 600 milligrams with potassium clavonate, 42.9 milligrams per 5 mLs oral suspension. Give 4 mLs by mouth twice a day for 7 days, and advised her to follow up in 7 days or sooner if her symptoms worsen, such as fever, increased drainage, or increased pain. I also educated the family on importance of completing the full course of antibiotics, even if the child feels better. Thank you.